Hi everyone, my name is Ruth Wilcock and I'm the Executive Director of the Ontario Brain Injury Association. I want to welcome you to our multimedia podcast series. The mission of OBIA is to enhance the lives of Ontarians living with the effects of acquired brain injury through education, awareness, and support. We are so excited to have partnered with Headsup Concussion Advocacy Network and the former Ontario Neurotrauma Foundation to publish this multimedia podcast series. I would now like to introduce to you Ryan Sutton, who is the Executive Director of Headsup Concussion Advocacy Network.
Hi, my name is Ryan Sutton. I'm the Executive Director of the Headsup Concussion Advocacy Network, a nonprofit organization whose mission is to challenge the stigma surrounding concussions. One of the most effective ways that we have found to spread awareness and education on this injury is to share the stories of people directly impacted by them. That is why my team and I are so excited to be collaborating with the Ontario Brain Injury Association and the former Ontario Neurotrauma Foundation to produce this multimedia podcast series.
Well, welcome everyone. My name is Dr. Lesley Ruttan. I'm a psychologist and I practice in clinical neuropsychology and clinical psychology. I've worked at Toronto Rehab at the University Health Network for many years, working with both inpatient and outpatient individuals who have suffered from acquired brain injuries. And I also work part-time in private practice. I'm really pleased to be here today with a group of individuals who have a lot of great experience in supporting individuals following a concussion or traumatic brain injury. And so we're hoping to have a great discussion about a number of topics around supporting individuals today. Thought we could just start off by having everyone just introduce themselves and provide your first name.
Hi, I'm Carla.
Hi, I'm Katie.
I'm Karen.
I'm Kim.
I'm Brittany.
Great. Thanks so much, all. So I think we're going to just jump right in. And we've got a number of topics sort of up for discussion today. The first one that we'd like to talk about are what are the challenges that you've experienced connecting people with supports when you've been working with people with concussion or brain injury? Any challenges that you have faced over the years?
Just to start this discussion, I mean, I think the biggest challenge these days has been COVID for a lot of people. Sometimes the biggest challenge is actually just trying to connect the individual to the services that they're looking for. And it depends where they are on the continuum. If we're talking survivors who are, going through being in the hospital and transitioning to rehabilitation and then transitioning back to their home community, I mean, there's challenges along the way. And then there's challenges for the caregivers who are just trying to cope with, their loved one being injured and then trying to find information and supports for themselves too. So, there's both challenges for the survivors and challenges for the caregivers as well.
Mm-hmm. Absolutely.
I think I'd like to add, one of the things I've noticed is the wait list for services. That's a huge challenge. So we try to connect people and then they find out they have to wait another 7 months or 9 months before they can see someone. Also, people living across the province have access to different services because we don't have the same level of services everywhere. So if you're living in a remote area or rural area, there's not much available. So that's definitely, a challenge when you're looking at supporting people.
Right. Yeah. Karen.
Yes, I also find that there's a real lack of publicly funded services. And depending on the specialists that people need to see, it can be quite difficult to find. And even though people may have workplace benefits, those benefits are limited. Even when people have motor vehicle insurance funding, sometimes they are questioned by insurers that because it's a mild brain injury or concussion, they ought to be fully recovered, and their benefits are denied.
Mm-hmm. Absolutely. I would agree. And I think sometimes for concussion, it can be even more challenging because, there are individuals with concussion that may not end up going to the emergency department, that may not, just may only see their family doctor. And if their family doctor isn't really well versed in terms of what's available, I hear that often in my work, is that people sort of fall through the cracks.
Mm-hmm.
Anyone else that wanted to comment on that one? Yeah, Brittany.
So I think one thing that I've sort of dealt with both in the work that I do with people with concussions and my own experience is just kind of knowing what the resources are. I think especially like immediately after a concussion or brain injury, especially for the person who sustained it, it can be challenging to even know where to start. And so I think that especially for people who say don't go to the hospital or just go to the family doctor, it can be difficult to, if they don't provide the information, to know where to turn.
Mm-hmm. Mm-hmm. Absolutely. And I think, I think we're moving in the right direction. I know there are some emergency departments that are providing more information. There are, for example, at Toronto Rehab, we actually have a research clinic called the Ellis Concussion Clinic, and it's been running now for a number of years. It was initially funded by a couple of NHL players. And so what they're doing, they're actually taking people from select emergency departments, or they're given information when they're in the ER if they want to participate in this, and then they can actually be followed up in this clinic. So it's great, because I think, as we were hearing earlier, I think Karen had mentioned just a lack of publicly funded resources for people with concussion. They absolutely are lacking, or they're hard to find. So yeah, great. Okay. The next one was, what challenges have you experienced in supporting others, and what is the most challenging? I guess it's similar to the first one, but any additional thoughts in terms of supporting others?
Yes, I find often there are misconceptions about mild brain injury or concussion. And so the clients that come to see us have expectations for recovery, and recovery right away, as soon as possible. And people want to get back to their normal lives, back to work, back to sport, activity, or school really quickly. And when that doesn't occur and there are persisting symptoms, it can be really demoralizing and frustrating for these individuals. And many of these individuals that we see are rather high achieving individuals as well. So they're accustomed to setting a goal, working hard at it, achieving the goal. And when that doesn't happen with their concussion recovery, it can be really frustrating for these individuals. Yeah. So the education around the recovery process is really key, and how there could be a range, and that persistent symptoms can occur as well.
Yeah, absolutely. That's a great point. Anyone else wanted to? Yeah.
So I also think people who have mental health issues, addiction issues, in addition to having a concussion, and they are trying to seek support for everything at the same time, it's quite challenging, because we don't have comprehensive services available. And they often complain that, people are not understanding my symptoms when I go here, and because they don't have anything to do with concussion. So that's definitely what I find challenging. And another thing is, I think, Lesley, you mentioned that having a family doctor who's not on board makes it extremely challenging for us to be able to get them any medical referrals. And trying to find a new doctor is not easy. And so it kind of creates a very complex path for a person, even though we are able to give them resources and guide them through the process. We can't make those medical referrals. So relying on the doctor becomes very important. And I just want to add the online groups that have started. They're great, but they're also places where people gather a lot of information that they think they should be getting these type of services. Not everything is evidence-based. I find it very challenging to tell them, this works, but not necessarily concussion, not enough research to support this, and that sort of, little bit of difficulty around that.
Absolutely. I've experienced the same thing, Katie, in my work, some of my work with the Canadian Concussion Center, where we were running education and support workshops and would have individuals that had persistent symptoms. And it was always, it's a bit of a fine line because there's, of course, the concussion, the media coverage, and it's just the awareness is very much increased, which is great. But there are also, of course, lots of claims, as you say, that aren't for different products and supplements and, things that can supposedly cure your concussion. So it's about, I think, educating people. Yeah. I'm not, Brittany, did you have your hand up or was that up from before? I'm not sure.
No, yes, I do.
Okay. Okay. Sorry about that.
That's okay. So my experience is in university settings specifically. And I think that a big challenge is just the environment of university and being able to meet expectations there. So kind of building off of what Karen said earlier, a lot of students do have like goals and things they want to reach. And so the support that some of them need, especially if their concussion or brain injury is more significant or affects a lot of different areas. It may be just that they need to take some time off of school. And that can be a big challenge for students to accept that and be okay with that. And then kind of figure out when they do get back adjusting.
Absolutely. From a psychological point of view, it can be tough when you're in the middle of a program and feeling like you've been set back and you're behind your peers. Carla.
One of the other things that I've gotten a lot over the course of my career is just the sheer volumes of paperwork that people need to complete and fill out and get back to insurance companies or WSIB or, even lawyers. We hear a lot of people calling our support line, our helpline, just to say, I need help filling this paperwork out. Or they just get buried in it. And sometimes that can be a really big barrier for them, getting the services, getting the compensation in a lot of ways that they maybe are deserving of. So that seems to be a lot of, survivors and even caregivers. They're just inundated with all of this paperwork and need help and support to try to figure how to get through that.
Absolutely. That's such a great point. And I've certainly experienced that with clients, and especially, when someone has just had a concussion and often is not feeling so well, maybe, cognitively not as clear or as quick, may have difficulty understanding. It really makes it challenging then to have all of these forms that they need to complete.
Well, throw in a memory deficit too, and then, you're trying to, read very small fine print on a lot of these forms. And, if they have a visual impairment as well, that can be a huge barrier to them getting through that paperwork. So, it is really difficult for our folks.
Yeah, for sure. And I think I'm just kind of harking back to something I think Karen was talking about, just in terms of, around people that are maybe supporting the person with concussion. Certainly what I've experienced is, and I think it's like with any brain and other kind of brain injury or any kind of illness or injury that's invisible, where, you don't see anything obviously wrong with the person. I think this is even more likely to happen with concussion, where, friends and family, they see the individual, they're doing, they seem to be fine. But the difficulties that they're having, even for family that, is living with them, it can be hard for them to completely understand what's happening. Karen.
Yeah, I totally agree with that, Dr. Ruttan, that because of the invisible nature of their concussion, and as well society misconceptions about concussion and the recovery process, these injured individuals are expected to just bounce back, and that's what families expect of them. Even though they may have been informed that there are persisting symptoms, it's hard for them to negotiate that the loved one can be impaired to the extent that they are with respect to attention or memory or concentration or focusing or energy.
Mm-hmm.
Fatigue is quite significant for a lot of these people. So that can result in role changes within the family. So if it was somebody who was in a caregiver role, the spouse may have to take over, or perhaps parenting responsibilities, someone else may have to pick up the slack. So it does really require a family-centered approach to educate the family, significant others, around concussion symptoms. And that's where I often send them to these workshops at the Toronto Rehab Institute through your program, Dr. Ruttan, that I think it's really important that the family members get educated about the symptoms, how they may present, and how best to support their loved ones. And for the adolescents, there are the concussion and youth seminar series at Holland Bloorview. So families are encouraged to attend those workshops with the youth as well for the education.
Yeah. It's so important because we know that family support, is so important in recovery. And we know that people that don't have that support, and moreover, if the individuals around them are even questioning them, which, can be even more harmful, really can take a psychological toll. So yeah, thanks, Karen. Katie.
Yeah, so everything Karen said, because I do run caregiver groups for people supporting individuals with concussion. So I have noticed all of those issues. I also want to add, there is a financial issue that comes up because concussions don't necessarily have the same sort of funding or qualifying for ODSP. And so, yes, you have this individual who cannot perform all the functions they used to do before, but there is no financial compensation of any kind. I'm talking about the people who are not obviously in the insurance stream of things, but, so there automatically the struggles just increase on the family side because there is now the stress of lower income and whatnot with that. So I think that's also something that comes up a lot.
Yeah, absolutely. When they're already feeling unwell and perhaps unable to get to work, it can add to the stress and kind of mental health symptoms side of things. So those are really great points. So the next one is, what supports do you perceive to be the best? And are there any gaps that you see?
So I think I'll start with the gaps. I've noticed that especially in the post-secondary environment, there are definitely gaps there. There are supports, but they're often kind of separate and people don't always know how to access them. There's student accessibility offices. Some people will be able to go there, but that's more for people who kind of have prolonged symptoms. Some students will just go talk to their professors. There's a lot of different ways to get support, but it's not necessarily streamlined. And I can only really speak to my university. I know that different universities have different protocols and things as well. So I think that the post-secondary environment and supporting students there is definitely an area that needs to kind of be built. So I'm working on my master's of education, and I'm looking specifically at supporting students in the post-secondary environment and kind of finding a way to make it a little bit easier so that when they do come back to school, they don't have all the obstacles that they have to get through in order to even sort of start.
Oh, that's great to hear. Needed. Perfect. Katie.
So what I see that is best is the amount of information that's online now in terms of the ONF guidelines and great resources put out by different hospitals and different clinics and so on. It really helps us send people information, even if they are not able to go in person. They're able to watch all this, get that information out to them. That's become easier. And as far as the gaps, I think I have to go back to the publicly funded problem. That is the huge gap. And I think especially I want to say with certain types of therapies and, whether it's vision or neuropsych, there isn't much in the publicly funded system. People come asking for it, but especially if they're outside the first year, it literally just falls down to zero. They don't qualify in any clinic. I think that's a huge gap because people are finding out more about concussions. They're looking at their past and also finding out all these concussions they had that never got diagnosed and whatnot. And now they want support. And there isn't anything because, it's not the 3 months timeline. It's not the 1 year timeline. Nobody's going to take you. So I think that's a huge gap.
Mm-hmm. Yeah, thank you. Kim.
Yeah. I also run the Love Your Brain yoga program in Peterborough, which is a great program for those living with TBI and concussion. And I find at the end of each session, we run a facilitated discussion. And usually it takes a few weeks, but I feel when people that are living with similar difficulties come together and they start to open up, I think just sharing and it sort of validates what they're going through. So if you have others that are, skeptical about, they look fine, it's really healing for them to come together and talk about what they're going through. And there's some really deep friendships that develop. And also at BIAPR, we run a lot of women's groups or peer-led women's group. And after a few months, those, the participants are so closely knit together. Mm-hmm. And it's so healing for them. So I feel just coming together and sharing experiences is probably one of the most beneficial.
Yeah, that's great, Kim. Yeah, I would absolutely agree. And in the workshops that we had been running for years in person up until COVID hit, we would often get the same feedback. There were individuals that were out there that really felt like they were the only one.
Right.
So really helpful for them to realize that no, there are actually other people out there struggling with similar issues. So.
Mm-hmm. And twice I've had dads that come with their daughters, as a driver and say, can I sit in on the class? And they do. And both of them have had tears in their eyes at the end and saying, I had no idea what my daughter was going through.
Yeah. Amazing. It's really good to hear. Yeah. Carla.
I just want to kind of echo what Kim had said, finding the supports for that individual and what their needs are and what their wants are. I'm kind of a similar program to what Kim was doing, but our provincial peer support program matches people one-on-one. And Kim was talking about kind of the friendships that develop out of that, coming together and sharing your experiences. And I think more than that, for our folks, it's about knowing that they're not alone and that there's other people that are out there that are experiencing, the exact same thing. And in our program, the peer support program, we match kind of a partner or somebody looking for support up with a trained mentor. So somebody who has had lived experience, who may be a little bit further on down the road or through their journey in rehab and recovery. And, the neat thing about this program is it's all done over the telephone. So kind of no matter where you are, you don't have to have an internet connection. If you can pick up the phone, you can be part of the program and receive some kind of support and help and understanding, literally from the comfort of your own home. So folks don't have to travel, because we know that, travel can be a huge challenge. Even transportation can be a huge challenge for our folks after concussion and brain injury too. So, finding those supports that work for that individual, I think, is really key and really helpful. And for the caregivers as well. Caregivers connecting with other caregivers who are trying to manage their loved one at home and trying to kind of carve out time and carve out some supports for them as well. Those can be really, really great supports for them. And I think, just having that somebody on the other end of the phone to listen to what they're going through and to provide maybe some of their own feedback and thoughts through their own experience, to let people know that, yeah, you can get through this. Here's some of the things that worked for me. Here's some of the things I tried. So it's kind of like a brainstorming session. It's kind of a check-in to see how people are doing. But I think, it's very individualistic.
Mm-hmm. Yeah, I often suggest that program to people. I think it's fantastic. I really think it's a win-win, for both the mentor and the mentee, and for those individuals that have been struggling and then are able to progress to actually, mentoring someone else can be a positive thing. So great, thank you. The next topic, what are the support needs that people come to you for? And this could be at different stages, acute, subacute, more chronic. What are you seeing?
On the helpline, we get people in almost every stage. So there are people who just had an injury. They're wondering if they should go to a doctor or a hospital. You have those people. Then you have people who have seen the doctor, got diagnosed. They're asking us, what are the best practices? What should I do? What shouldn't I do? So you have those people who are seeking information or asking, who should I see? Because I think, as Brittany mentioned, people don't often know who should I be seeing. They don't know all the professionals involved in the recovery or treatment. And then you have people who are in the post-concussion stage because they haven't recovered and they're perhaps feeling a little bit scared that everything that they have been told was 3 months and you should be all good to go. It's no longer happening. So they want some sort of, they want support. They want to feel like, as I think Carla was also talking about, Kim, isolation. They want to know that they're not alone in this. So we have those people. And we certainly have people who are, post 1 year, post 2 years, who are also coming to us for long-term supports. And I think the other piece is the advocacy. They do come to us a lot for advocacy because maybe the workplace is not understanding. They want us to step in and provide some information, or they're seeking help with applying for ODSP. They want some sort of support or provision of what does research say about this particular issue? Can you guys write something for me? That kind of speaks to what I'm experiencing. So the advocacy piece is also huge for us.
That's great. Thank you. Karen.
Hi. Now, as a registered psychotherapist, people come to me around their mental health symptoms. And often they are dealing with persistent concussive symptoms that have not resolved over time. And they may be presenting with mood adjustment issues. So depression, anxiety is not uncommon. And those people would really benefit from a course of cognitive behavioral therapy to help them manage those symptoms. It's also not uncommon for people to present with post-traumatic stress symptoms. So if someone was in a motor vehicle accident, for example, they may have trauma reactions or persistent anxieties related to the car crash, or anxiety around driving again or being a passenger in the car. They may still have hypervigilance and hyperarousal symptoms. So trauma-informed therapy may be helpful for these folks as well, so that their symptoms can be mitigated and not contribute to some of their physical symptoms that they're experiencing. I think people had alluded earlier to the loss issues. So when the concussion symptoms haven't resolved, it really takes an emotional toll on the person, and they're grieving the loss of self or grieving the life that they had, wondering, will I get my life back? When will I get my life back? Nobody seems to understand. So it's a very lonely experience, and supportive therapy can be helpful for people to navigate those losses and to connect them with peer supports, like through OBIA, the peer support program, the group experiences that can be helpful as well.
Yeah, absolutely. I couldn't agree more. I think, especially for people that are more in the chronic stages where there was this expectation, well, I should have been back at work or back at school, I should be symptom free. It understandably takes, a psychological toll. And so it's not really surprising that they are struggling with things, as you say, like anxiety and depression. And of course, the big concern around that is that can actually exacerbate other things that are going on. And so I often talk to people, about that vicious cycle that you can get into. But those are great, supports that you mentioned. And just to mention another support, and I'm not sure if this is the one you were referring to earlier, Karen, but at Toronto Rehab, we have it's been up and running for a few years, the Tele-Rehab Center. And this actually preceded COVID, but it's through Dr. Robin Green's lab at Toronto Rehab. And so what they're doing is running, and these are free. It's all group based, so there's no individual, but they've got now, it was originally just for more severe brain injury, but now they've included concussion, and there's a sort of a psychoeducational group that they can participate in. There's cognitive behavioral therapy, there's goal management training, mindfulness skills. So it's just yet another resource that people can tap into, and also not have to pay out of pocket, which is nice. So, yeah. Anyone else on that one? Kim?
Just as, I'm not qualified really to answer this, but one thing I have noticed is that those that have experienced a concussion and their sense of loss and knowing, what they're facing is much more pronounced than someone who had a more catastrophic injury. And I noticed that early on at Toronto Rehab. And I remember asking a doctor, they were saying, well, it would take too long for me to explain that. But I certainly know, as my son was a Glasgow Coma scale of 3. And, he goes off, he gets up and goes to work. And he, for the most part, he's, he doesn't really sense his loss. He just goes on life and takes it in stride. Where those with concussions, and maybe it's part because people aren't understanding them, but.
No, Kim, that's a great point. And I would see that, I do see that at Toronto Rehab on our outpatient program, and where absolutely it's really quite interesting. Individuals with more severe traumatic brain injury often, and it may be part just a function of the severity of the injury, and that their awareness and insight into the losses is a little less pronounced, but that's absolutely something that we see all the time. Brittany.
Yeah, I think I'm kind of in a unique position right now. I did work in a student accessibility services office, but now I'm still a student. So I think in my experiences, I've kind of worked with students who are more in the acute phase after a concussion, but then also I think most of the work is kind of the chronic post-concussion symptoms. Because as I referred to earlier, those are often accommodations can be put in place for more acute injuries, but if somebody's going to recover within like a week or 2 weeks, they're often very sort of short-lived. But then as the injury and symptoms from the injury remain and persist, then more accommodation may need to be put in place.
Great. Thank you. wondering, do you find that people are accessing healthcare for diagnosis following a concussion in the people that you see?
I think it sometimes depends on how they got their injury. So I have noticed people who have got concussions from intimate partner violence tend not to seek medical support right away. And whereas, somebody who's had a sports-related concussion might get that immediate attention and seek that medical support. So I think that plays a factor how they receive the injury. And sometimes they do realize that their symptoms after a couple of weeks, and that's when they don't go immediately post injury because they think it's not a big deal. So that's the piece I wanted to.
That's such a great point and interesting. I think there is more focus now on intimate partner violence. I think it was not something that we had, traditionally thought of when, I think initially with the increased attention to concussion, it was always on sport. It's good that has come to attention, but also makes sense that they don't seek out the help as often, unfortunately. Brittany.
So I think building off what I said before, in the post-secondary environment and specifically in the Student Accessibility Services Office, a lot of students to leave accommodations need some sort of documentation. So usually it will be from a family doctor, but it can be from like psychiatrists and different resources. But so in that case, they are accessing healthcare in order to receive the accommodations that they may need.
Yeah, that's a good point because often there is, that documentation forms that need to be signed. Carla.
I just kind of wanted to echo off of what Katie was saying about, going to the hospital, receiving medical attention. But I think a lot of people, again, think, it's just a concussion if they've seen their family doctor and they've been diagnosed, but their symptoms are pervasive and they're, still having difficulties. And, they have this expectation that, okay, if it's a concussion, then, I'm going to be better in, a short amount of time. And I think if those symptoms really persist and get worse for some folks, or trying to kind of go back to what their regular life was like too quickly without kind of taking that time to kind of slow down and listen to their bodies and with these days with COVID, a lot of people working much more on computers and at home. So they're not kind of taking that rest time, and that time to recover too. I think people are kind of trying to force that issue. So we see a lot of people that are having persistent symptoms of concussion because it is the time, or that's what's happening with them in their home life, and they're not kind of I don't want to say they don't take it seriously, but I think they're just not listening and responding to their body and trying to kind of push the envelope a little bit.
That's a great point, Karen.
I find that with youth, often the parents are the ones to get their sons or daughters in for concussion diagnosis. There's been much more outreach and education to the community and coaches around concussion in sports. And so if parents are on top of this and they see or notice changes in their son or daughter, they're likely to often reach out and try and get a diagnosis much more readily.
That's great. And I think it's great too that there are so many more online resources for people to access, assuming they can find them, but certainly with the ONF guidelines, and they've got a patient version now, and just with, for both acute and more chronic in terms of what to do and when to seek help based on. So, the next one is, why do you think people struggle speaking about their challenges? Or have you experienced that? Are there cases where individuals have difficulty actually acknowledging or talking about what has changed or what's difficult for them.
I think that this builds a little bit off of what Carla was just saying, but I think it can be hard to not compare what things were like before. So I know I have the same 3 concussions, and the first one, it was very difficult to accept the fact that I had to take less courses because I knew what I was able to do the semester before. And so I think it, especially if the person is a high achiever or is working or doing something that they want, I think this is true in sports too. It can be difficult because then a person may be pulled out of the game, which is important to them. So I think that it's kind of, there's a lot of factors that play into it and into accepting it and being able to communicate that.
Mm-hmm. Absolutely. Thank you. Carla.
In the peer support program, we see a lot of people that may have a lack of insight into their injury. And sometimes a lot of online supports are group supports for them. And sometimes they just don't feel comfortable in that medium. So it's one of the nice features of a one-to-one program is that they can kind of really open up to a mentor or somebody who's been through a similar experience, and having that person consistently, on a once a week phone call. I think a lot of our folks tend to feel a little bit more open to speak about some of the challenges and the changes that they've seen in themselves. But sometimes the lack of acceptance that, okay, this is what I am right now, or this is who I am right now. But I'm struggling really hard to get back to the person that I was before. And a lot of people, it takes an awful lot of time for them to accept the fact that there may be challenges that they may have continually. There may be things that they can't do in the same way that they did before. And our mentors are really, really great at kind of saying, yeah, I've been there. I know what you're struggling with. It took an awful long time for me to find a coping strategy or a way that I can deal with this new nuance in my life, that can be really successful over time for folks. So I think, it's about an insight into an individual's disability and sometimes the challenges that they have that may remain for a long time after that injury. But I think it's an acceptance thing too. They have to kind of learn that, okay, these are my challenges, these are my struggles, these are my triggers. Now what can I do to help myself when I come up against those things?
Mm-hmm. Yeah, I think that's such a great point. And I think as we heard from Brittany, I think it's so often the case that individuals are comparing themselves for the concussion, and this is how I must get back to. So I totally agree that acceptance can be a big part of it. I think also, encouraging people to engage in a bit more self-compassion and self-kindness in terms of actually acknowledging, how far they've actually come since, the injury happened is important. So, Katie.
I think also there is stigma still around, especially post-concussion. Not so much concussion, but once those, you don't get better, there is stigma around that. And people also are struggling if they have pre-existing conditions that are like mental health conditions and other chronic pain conditions. They seem to struggle a lot more with insurers, especially wanting to know what did you have before, what happened with this, and person is a whole person, and it really doesn't, it's very hard for people to explain how everything gets impacted with one incident, and to them everything is tied, and they really struggle to articulate that because it seems like for funding purposes they're only interested in this one incident and the symptoms resulting from that, not the person as a whole and everything they're experiencing. So I think there's a lot of challenge around that.
Absolutely. Thanks, Katie. Karen.
Yeah, I like to build on what Carla and Katie were saying, that the nature of their concussion symptoms is so invisible and so misunderstood that when people actually try to talk about it with their friends or family, they often get invalidated or they get comments. Well, you look fine. You'll just bounce back. You're a resilient individual. You'll be back in no time. And it leaves the individual feeling more alone and more misunderstood. So it's not uncommon for them to clam up because it's not the kind of experience that the rest of the world can understand what they're going through. And again, that's where the peer support is really helpful. The other thing is, more often than not, individuals look the same as before. And when they're dealing with insurance companies, as Katie was talking about, they're often dismissed, like, you look fine, everything else is working, you may have some vestibular or visual symptoms, but, you're going to be okay, you don't need the help. So the invalidation by society, the invalidation by insurance companies, people who fund them, it just makes it difficult for these people to talk openly.
Absolutely. Kim.
Yeah, just to expand on what you had said, Dr. Ruttan, about some self-care. And I know early on with my son's injury, one thing that really helped was to write down markers. And quite often with brain injury or in concussion, it's, 2 or 3 steps forward and 5 steps back. So at a 3-month mark, write down what achievements have been made. And then, post as the injury goes on longer, maybe choose your markers at 6 months and write down and then go back. And quite often you've forgotten how far you've come.
Yeah, absolutely. I think that's so true. I think people forget, how, and don't realize how far they've come. So it can be really helpful to absolutely keep track of those.
Yeah. And then,
Yeah, no, go ahead, Kim.
Congratulate those achievements, rather than beating yourself up.
Yeah.
So easy to do. Saying I can't do that. Well, I couldn't do that 3 months ago, but now I can. So
absolutely. Yeah, Carla.
I've heard a lot of caregivers doing a lot of journaling about their loved one going through the various stages and going back and reading them even years afterwards and going, wow, I didn't see the changes that happened weeks and months, but you build them up over time. And it's really, really interesting for them as caregivers to go back and go, wow, you've come a really long way. And it's kind of interesting in our program that at the year mark, when those partnerships are about to kind of finalize, it's a great exercise for our mentors and partners to kind of review what's happened during the year. And again, it's one of those, wow, look how far we've come, or, look how many things we've been able to talk about and discuss and kind of work through together. So, I think there's a lot of hope, that's built in when they've got somebody to kind of champion through those stages in that year. And, the wonderful part about it is a lot of those folks that have been together for that period of time do go on and form friendships because they've gotten to know each other. And that's been one of the really great positives that came out of the program is a lot of our folks do stay in touch. And because they found a kindred spirit, because they connected on so many different levels that kind of go past brain injury. These people are still humans and still live, lives. So it's not just solely based on brain injury and the friendships do form. And it's really great to see them, blossom over time. And we've had people who have been connected now for 16 years because they were once a mentor and a partner in the peer support program. So that longevity happens in the program too. And they've always kind of got a champion in their corner or a supportive person who's kind of been through the same thing. So those markers are really great to kind of go back and revisit and go, wow, like it's really, really amazing how far people have come, especially if they were injured as a child. And then going through, adolescence and post-adolescent stages where it can be really, really trying, for themselves and for their caregivers and parents and family members as well. So, it's a very unique, injury, and it's a unique journey for every one of, our folks who have been, injured or affected or are living with the effects of brain injury or concussion.
That's great. Thanks so much. Karen.
Yeah, I really agree, Carla. It's so important to focus on how far one has come versus continually comparing themselves to their pre-injured self, because it's much more encouraging. And I like to often adopt what I call a solution-focused approach with my clients, because it allows them to not just focus on their deficits, because that's what happens after a concussion and there are persisting symptoms. People don't feel understood, so they need to prove to others, yes, these symptoms are legitimate. So it can draw a hyper focus to what's wrong, what's not working, the deficits. And that can take over one's identity and that sense of self. So it's really important to move beyond that and also look at what is still working well for you. What are the strengths and resources? You can't do these things anymore, but what could be possible? And how can you build on that? And I find that adopting a strength-based solution, future-oriented focus can help bring people along that trajectory of hope in a way that focusing on their symptoms sometimes makes it more difficult.
Absolutely. Which is why that support is so important for them and to be encouraged. Not to put you on the spot, Karen, but this next one is sort of directed to you. Do you think the support needs for adolescents and youth are different from those in adults?
Yes, they are. I mean, number one, the brains of adolescents are still developing. So sometimes families come to us asking, is this normal adolescence or is this concussion or brain injury? Sometimes they can't tell the difference because they overlap with each other, or the developmental stages of adolescence can exacerbate what's happening during concussion. It's also not uncommon for families to think everything is attributed to the concussion. And in fact, sometimes the teen is just going through those developmental changes, and the impatience, the rebellion we would typically see. So again, it's helping the families navigate what parts might be developmental and what parts might be concussion related. The other thing I also find with adolescents is that often when families come to us for help, and often it's initiated by the parents because the youth don't navigate the systems totally independently like the adults do. There's often much more acceptance for the physical therapy. So if it's a sports-related injury, getting back into physiotherapy, getting some occupational therapy to help advocate around return to school. What doesn't seem to be accepted with the same enthusiasm is the mental health counseling piece. And there may be a stigma related to it, or it could be, for adolescents, it's just not cool to go for counseling. They want their lives back. They want to get back into the sports and activity. So I find it's very important when we're working with that population that an interdisciplinary model be used so that the physiotherapies, the speech and language, the OT, the counseling, they're all integrated, and it helps to normalize acceptance of the variety of different forms of help that could be used for the adolescent and the family. And again, getting the family on board so that both the teen and the parents are on the same page around how to optimize wellness for the teen.
Mm-hmm. That's great. Thanks so much, Karen. That's really helpful. And yeah, in terms of, the concussion symptoms and how, over time people can attribute, any symptom that they're having to their concussion can be equally problematic. And we certainly see that in adults as well. And I think part of it is that, there is that stigma, I think, with mental health. And so I always try and remind people that, what we're thinking and what is happening from a mental health perspective very much is very closely tied to what's happening physically in our bodies. And I think if people better understood that, it wouldn't, it would make sense that, well, actually the physio and the, the emotional and thoughts and behaviors, all of these things, mesh together. So, thank you. Carla.
And I think we need to go back and remember that there right now across the province, there's not a lot of youth-oriented, adolescent-based programs and services. A lot of the brain injury associations are serving more of the adult population. A few of the brain injury associations now are really starting to recognize that there are needs and programs and services are needed out there for the adolescent youth population. So some of them are actually developing some programs and some services around that age category. But there's not a lot out there. So we often rely on Holland Review and other, child service-based hospitals to find programs and services, but there's really not a lot out there.
Great. Thanks, Carla. Katie.
So one of the caregiver groups we run is exclusively for parents. And one issue that comes up a lot is when children are transitioning into adult, the 18 age, when that's usually the time when parents are kind of also experiencing that transition, because a lot of service providers no longer keep them in the loop. They are now the child who's become an adult is supposed to navigate these systems on their own. Yet, up until like very recently, the mother or father was the one doing everything, and so they struggle a lot with that transition phase. And sometimes, you have the teenage, understanding of, or not realizing, the teenager not realizing how important it is to sign that paperwork so the parent can be with them. So, it oftentimes they talk about that as being a struggle. And also, transitioning into university is something they bring up because they have all these fears. They have been very protective, and allowing the, child to be now more independent, while they still have these symptoms. I think a lot of parents bring that up as, something they fear, like they can't protect them anymore.
Thanks, Katie. Brittany.
Yeah, I can just add to that. So, in my work at Student Accessibility Services, as a student staff, my main role is transition programming. And so, this is kind of just more disability in general, but it did also include acquired brain injuries. But we had specific sessions for students and parents. And we did that mainly because there are different needs, but also kind of giving students the sort of feeling of what it's like to talk about things and ask for what they need without their parents. So to kind of help in that transition and to make it a little bit more smooth.
Great. Thanks, Brittany. Karen.
For those people who do work with adolescents, it's really important to start that transition process early, not when they're 18. And so perhaps even in the early teen years, help the teen develop their own voice around self-advocacy and how to advocate for their own needs, how to be able to describe their symptoms and ask for help with their providers, and coaching parents around how to support the teen around navigating the system. So this process needs to start really early so that that transition can be more easy, because as you were saying earlier, once they turn 18 and the parents aren't allowed in the room, they're not allowed to meet with the special needs department to advocate for the student in post-secondary. It can be quite an eye-opener and really difficult to navigate.
Great. Thanks, Karen. Okay, so we have one final topic question to cover. And this one is, how can we build an environment where everyone is working toward the same thing in a support setting?
This question specifically, I think it kind of relates to what I'm doing for my major research project with my Master's of Education program. And so my main goal is to basically try to create an environment that does this. Because I think in my experiences in post-secondary with concussion, it was very helpful when I felt like everybody was kind of integrated and on the same page. And it can be difficult to have to go to say student accessibility services and academic advising. And it's kind of going in a bunch of different directions. And so my hope is to kind of try to create something where it's all a little bit more centralized. And it wouldn't be so much like individual needs, although that would kind of fit in. It would kind of just be more general, like how as an institution and a university can we create something where everybody is on the same page.
Yeah, I think integration is so important. And I think especially again with concussion and that population, the feedback that I've heard from people is that they're often trying to piece together their own, their own treatment. And that's really hard to do, as someone who is, as we talked about before, struggling potentially with cognitive difficulties, physical difficulties, and then to try and have to maneuver the health system on their own can really be a challenge. Yeah. Anyone else have any comments in terms of things that, I guess in an ideal world, what you'd like to see that could better support people? Katie?
I'll go with the ideal world. Definitely better funding for services, I think, across the province. That is a huge thing. I also think we need to continue with awareness, raising awareness, not just concussion, but PCS, where the research is coming in every year. And I know a lot of it appears, I should say, from what people see on the helpline, a lot of family doctors are not necessarily keeping track of what the latest research is saying. So definitely, if there's anything that could be done in terms of educating frontline healthcare professionals into incorporating the latest information into treatment, that would really help our people. And I think we continue to promote hope. That, just having PCS is not the end of the line, that you can continue living a fulfilling life. So I think that's important as well.
That's great. And I'm actually happy to report that on your, in terms of better educating frontline practitioners, I have been involved in a project called ECHO, and they have an ECHO concussion. And this is basically, it's funded by the government, and it's concussion education for frontline healthcare workers, so family physicians. We've had a really wide range of individuals. Anyone, you have to register, but it's free. And then there's a whole team, sort of a hub and spoke model. So there's a kind of a hub team of different types of specialists, and then each week we cover a different topic on concussion, and the individuals attending bring cases forward where they have some questions. So I think we're moving in that direction, but still a long way to go. But thank you. Carla.
I go back to kind of our tenets at OBIA, which are support, awareness, and education. And I think that's, kind of where we all need to be. Having dedicated helplines, having, a dedicated phone number where people can go and say, hey, I'm looking for XYZ, where can I go? And then integrating, if we could do like kids help phone that has information about brain injury and kind of really getting the word out there and where people can go to find information and resources. I think sometimes folks get kind of put in their own silos and they're working. And I think collaboration needs to be a huge part of this. So that we can have an integrated system where, we may not have all of the pieces of the puzzle, but we can kind of help to put that puzzle together for folks. You may get this piece from here and this piece from there, but, we have the ability to find those pieces and help people kind of put their own puzzle together.
Absolutely. Thank you. Karen.
In light of the recent news about the Ontario Neurotrauma Foundation, I'd really love to find a way and encourage everyone to continue to embrace the best practice guidelines, the TBI guidelines that ONF has put out. I have found them to be so helpful in guiding my practice. I often refer my clients to them. I use them to advocate for funding for my clients with motor vehicle insurance funders. So this is such a wealth of resource through ONF, and I think it's important for all of us to keep this alive.
Absolutely. Absolutely. Any other last thoughts? I'm just conscious of the time, and I think we're almost up, but anyone want to have a last word or? No? Okay. Well, I really want to thank all of you for taking the time to come together today and to be so open and sharing your wide breadth of experience about supporting individuals with concussion. It's really been, I think, incredibly helpful to hear all of your different experiences. And just want to announce that the next podcast will be a discussion of life after concussion, facilitated by Becky Moran, who's an occupational therapist with St. Joseph's Healthcare in London.